Hey guys, Dinaya. So here's a quick summary of anti-rheumatoid drugs. So first of all, what is rheumatoid or rheumatoid arthritis? This is an autoimmune disorder that causes result to chronic inflammation of your joint or that attacks your joint. This is by the release of this what we call the pro-inflammatory cytokines. Uh, and it occurs when we have leukocyte migration, which result also you have also B cell activation, resulting to T cell activation. All this process, which at the end of the day will result to activation of these pro-inflammatory cytokines. The cytokine now, as will release now these three mediators that are key in causing inflammation. That is tumor necrosis factor alpha, interleukin 1, and interleukin 6. Those three mediators now, they're the ones which will attack your joint, yeah, which result to pain, yeah, you're not even able to move. Like, rheumatoid arthritis is a very bad disorder, and actually it's a lifelong disorder because it's autoimmune. Yeah, it's your body, your antibodies attacking your healthy cells. So how do we manage these drugs? Because I've said it's a lifelong disease. So how, like, do you manage the disease? So we have two classification of these drugs. The first classification is the drugs that will reduce the disease or the drugs that will decrease the disease progression, and the other class of drugs is the drugs that will leave now the disease symptoms like pain, yeah, inability to move. Those drugs, for example, they will like relieve, they will act as analgesics, yeah. So let's start with the classification. I've said it we have two those classification, either the ones which will decrease the disease progression or we reduce the disease symptoms. So we have the first types of drug is what we call the DMARDs, or the THADs, disease modifying the disease modifying anti-rheumatoid uh, drugs, DMARDs, or you can also call them short acting. You can also call them the short acting anti-rheumatoid drugs, the SADs. Yeah. So they are divided into biological and non-biological ones. So let's start, and then we have the other class that is adjuvant drugs that helps to relieve the disease symptoms. Let's start now with the non-biological one. And biological one, we have be giving just examples. Non-biological, we have the immunosuppressant. For example, we have methotrexate, we have the cyclosporin, we have penicillamine, we have also azia, aziatropine, aziatropine. Yes, azathioprine, yeah. Then we have the other non-biological drugs is sulfasalazine. We have also leflunomide, and also the chloroquine, yeah, chloroquine and hydroxychloroquine, yeah. Those are the non-biological DMARDs. Then we have the biological one. The biological one, these are now they affect the specific part of the immune cells of the immune system. For example, we have the drugs like a drug like that inhibit or block this mediator, the tumor necrosis uh, alpha mediator. So we have those drugs that inhibit the TNF alpha. For example, we have infliximab, etanercept, yeah. Also, I think that three: infliximab, etanercept, and also adalimumab, yeah. Just know those three. Then we have the drugs that inhibit or they prevent or they deplete B cell. And remember, if you understand the mechanism of action of this, that when you activate the B lymphocyte, result to presentation of T lymphocyte, and T lymphocyte will lead to the release of these cytokines. So when you deplete the B cell, this series of releasing cytokines will be shut. The example of drug is rituximab. Yeah, rituximab. I think I'm correct. Is yeah, rituximab. Then we have now the drug that inhibit the T cell co-stimulation, or presentation. This drug is what we call abatacept. Yeah. Then we have another drug which inhibit, which is a interleukin 1 antagonist, and it's called anakinra. Though this drug is not, it's rarely used these days. Then we have the drug that affect the interleukin 6. Yeah, interleukin 6, that is tolicizumab. Yeah, tolicizumab, that is the drug. I think I've exhausted in on the biological one. I think so, yeah. Then we have the adjuvant drugs. These are the drugs that are able to relieve pain, and also they have anti-inflammatory properties. For example, we have the glucocorticoids. The glucocorticoids we have, example as that is prednisone, uh, prednisolone, and also we have methylprednisolone. Also, sometimes the long-acting drugs or the glucocorticoids such as dexamethasone, dexamethasone, and betamethasone can also be used. Then we have the NSAID also can be used, and they help to relieve pain and swelling. But the thing with these adjuvant drugs is that yes, they relieve pain and also somehow inflammation or preventing the swelling, but the adjuvant drugs, they do not they do not prevent the progression of the disease. So that's why the DMARDs are there. The DMARDs now, they help to reduce the disease progression. Maybe I've not exhausted all the types of drugs, and if you have any additional, please comment on the just comment, yeah. Just part of revision that I was doing and a lot of sharing with you. If you have any additionals, just write in the comments, yeah. So till next time, guys. Bye. Have a nice time.